Welcome to Lean Forward, the Lupus Education and Advocacy Network program of the Lupus Alliance of Upstate New York. This video is part of a series created to inform and empower those affected by lupus and related autoimmune diseases. This program is for every lupus warrior, loved one, caregiver, and advocate who wishes to know more and do more in spite of a chronic illness diagnosis.
The following program is presented by two professionals, Dr. Buccelli, a general ophthalmologist, and Dr. Notaro, a retinal specialist, in order to provide a more comprehensive understanding of eye health. In Part 1, Dr. Buccelli addresses front of the eye health, and in Part 2, Dr. Notaro addresses back of the eye health.
Lupus can affect the eye in so many different ways. It can affect the skin around the eye, it can affect the surface of the eye, and any of the structures within the eye. A common presentation for lupus is dry eye. That's the most common thing that you do see. That would present itself with photophobia or light sensitivity, feeling like something's in the eye or a foreign body sensation. It can lead to fluctuation in vision, decreased vision, redness, and tearing. When a patient with lupus presents, we would typically do a comprehensive eye exam. We would start with your vision to measure how good you're seeing. We would then check for refraction for any glasses that may be needed. We would measure your intraocular pressure, which may be elevated because of medications that you take for lupus. We would also stain the surface of the eye to look for any dry spots and to examine your tear film. We can measure your visual field to map out any spots that may be missing. And there's a few other tests that may be done depending on the exam findings. The treatments that are used to treat your lupus may also affect your eye. Two common treatments are steroids and hydroxychloroquine, and both of those treatments can also cause eye conditions. Oral steroids can elevate your intraocular pressure. This is typically once you've been on steroids chronically or for an extended period of time, not a short-term dose. An elevated intraocular pressure can lead to glaucoma, which is optic nerve damage that can, in the long run, affect your vision. Hydroxychloroquine is another commonly used medication to treat your lupus, and that can affect the eye by causing central vision changes within the retina. This is usually monitored with a yearly exam to examine if this is happening to your eye. Eye symptoms with lupus typically come on very gradual, so you may not even notice a change, and this is why it's so important to see your ophthalmologist regularly. Some things, though, can come on quickly, so if your eye especially becomes red, painful, or you notice a decrease in your vision, please make sure you call right away.
Lupus is a widespread disease of inflammation through the body, and particularly with respect to the eyes, it can involve many of the structures in and around the eyeball. The symptoms are numerous. It's important for patients to understand what sorts of symptoms they might encounter and for them to be aware of them. There are many. Some include decreased vision, light sensitivity, floaters, redness, pain, blurred areas or blotchy spots, or decreased color vision, to name a few. But first and foremost, evaluation starts with a complete ophthalmologic examination, during which the ophthalmologist will look microscopically at nearly all layers of the retina, looking for signs of inflammation. Depending on findings, other tests may be ordered. Some of these can include visual field evaluations, looking for areas of blind spots. Special imaging can also be done, and is frequently done, to look in detail at layers of the retina. On the skin of the eye, one might notice rashes or scarring. The eyes can be red. They might notice sudden sun sensitivity or light sensitivity, or a new onset of floaters. Patients don't produce as many tears as they might otherwise, and the eyes can become dry. Nerve supply, blood supply to the eye and back of the eye particularly can be affected. Vision can be diminished. Bleeding can occur. These are many ways in which the eye can be affected and symptoms that patients may notice. Lupus patients are frequently treated with a variety of medications, but there are a couple that frequently come to the attention of the ophthalmologist because of the side effects that can result. One of these categories of medication is the steroid category. Steroids are frequently used in lupus effects, as well as many other conditions. And steroids come in a number of varieties. They can be given topically in the form of drops. They can be taken orally in the form of pills, and they can even be given intravenously if needed. Steroids, particularly if used for long lengths of time, can result in ocular side effects. Most notably, these are elevated intraocular pressure, such as can be seen in the condition known as glaucoma, and also cataract development. The anti-malarial drugs are another category of medication that is frequently used to treat many lupus conditions. You may be familiar with one, particularly called Plaquenil or hydroxychloroquine. This is a common medication, again, used to treat lupus symptoms. And in general, it has a very good safety profile. However, when used in some patients for long periods of time or at elevated doses, this medication can result in ocular toxicity. That is, it can act like a poison to the back of the eye, even though it's rare, because oftentimes these effects are not reversible, and the only thing that can be done is to stop the medication. Don't hesitate to go for at least an annual ophthalmologic evaluation where all of your eyes can be evaluated. Add to that a chronic disease such as lupus, and I think it's even more important to know and to comply with getting eyes checked as frequently as is recommended by your ophthalmologist. There are many things that one can do to maintain good eye health, but probably the most important is to visit with your ophthalmologist at least once a year. In doing so, he or she can take a complete look into all structures of your eye and detect early on any problems that may exist or may be arising. In addition to that, our number one, adequate lubrication. Dryness, as we mentioned, can often be a big problem for the lupus patient. And so using things such as artificial teardrops are very helpful. Secondly, keeping your prescription up to date, making sure that you are always enabling yourself with the best quality of vision possible. Sunglasses, it's a common one. Sunglasses are important for everybody, not just patients with lupus, to be worn virtually at all times, sun and shade, because we do know that ultraviolet light can have negative effects on the eye. When something feels unusual, problematic, a different sign, a different symptom that is being noticed, to not hesitate, but to call your ophthalmologist to make certain that you get in, be evaluated, and detect early on any problem that may be arising.
If you have questions, or if you're looking to connect with others on a similar path, contact the Lupus Alliance of Upstate New York. Their goal is to empower you to live your very best life.